Good morning, doctors. Welcome again. Today we are going to discuss about Cauda equina syndrome. The Cauda equina are a set of intradural nerve that provides sensory and motor innervation from lumbar 2 to sacral 5, the end of spinal cord. Why we called Cauda equina? Cauda equina is a Latin word. Cauda equina means a horse tail. Horse tail. Okay. The spinal cord tapers off at lumbar 2 as the conus medullaris. After lumbar 2, all nerve root derive from Cauda equina. Okay. Nerve roots of Cauda equina provides the sensory and motor innervation to hip muscles, lower extremities muscle, urinary and anal sphincter, and muscles important for sexual function. Okay, so I can explain this way also, like lumbar 1 and 2, lumbar 3, lumbar 4, and lumbar 5. Lumbar 1 and 2 responsible for hip bending, okay, or flexion. Lumbar 3 knee straightening, straightens the knee responsible muscle, and lumbar 4 responsible for bend ankle, okay, and lumbar 5 responsible for toe extension, okay. So lumbar functions, and sacrum S1 responsible for groin and back of hip, S2 responsible for back of thigh back bilateral, and S3 innervates the muscles of S3 innervates the middle of hip, and S4 S5 responsible for the innervation. We will discuss. Okay, now perineum, S4 S5 for perineum. Okay, Cauda equina syndrome. Nerve roots of Cauda equina provide sensory and motor innervation to the hip muscles, as I already told, lower extremities muscles, urinary and anal sphincter, and the muscle important for sexual function. Okay, the most common cause of Cauda equina syndrome is herniated nucleus pulposus. Herniated nucleus pulposus, slip disc or disc herniation. Other causes include lumbar stenosis, frequent due to osteoarthritis, trauma, neoplasm, metastasis, infection or abscess, and various inflammatory disease. Symptoms are going to vary based on the level at which the lesion is comprising the nerve. Weakness, anesthesia, sensory deficiency, and pain are practically always symptomatic features of Cauda equina syndrome. Okay. Now, Cauda equina syndrome history older, because as we age, the intervertebral disc normally degenerate. Age is a risk factor for Cauda equina syndrome. A patient with acute Cauda equina syndrome may have history of trauma, cancer, surgery consistent with cancer, chronic CES, may have chronic dull lower back pain. Symptoms: lower back pain, unilateral or bilateral, lower extremities weakness, sensory deficits, pain, paresthesia, loss of sphincter tone resulting in incontinence. Sexual problems, erectile dysfunction, fasciculation, reduced or absent DTRS. Location of deficits, weakness, etc. is going to the estimating factor where the lesion is. Patient reduced lower extremities strength, reduced sensation over particular dermatomes, pain reduced, absent DTR reduced, absent cremalstric reflex, lumbar 1, lumbar 2, reduced, absent bulbocavernous reflex, S2 and S4. Diagnose patients symptoms consistent with CES should get lumbar spinal MRI. It's a gold standard. Provided the patient is stable, this would be the best step in diagnosis and generally most accurate. Underlying cause need to found chest X-ray indicated. If patient has mesenchymal symptoms, get CSF analysis. Okay. Differential diagnosis by Guillain-Barré, amyotrophic lateral sclerosis, multiple sclerosis, diabetic neuropathy, spinal neoplasia. Okay. Now these are the sites. S1 affect hip and groin area. S2 affect the back of thigh. S3 affects the middle buttock area. S4, S5 affects the perineal area. Okay. And number 1, number 2 affects the hip bending and flexion. L3 for knee straightening. L4 for bend foot forward. L5 for extend toes. Okay. Now, patient back pain should be aware of the following red flag symptoms that may indicate CES: severe lower back pain, motor weakness, sensory loss or pain in one or more common both legs, saddle anesthesia, unable to feel anything in the body areas, recent onset of bladder dysfunction, urinary retention or incontinence. Recent onset of bowel incontinence, sensory abnormalities in the bladder or rectum, recent onset of sexual dysfunction, a loss of reflexes in the extremities, medical history implications, recent violent injury to the back, recent lumbar spine surgery, a history of cancer, recent severe infection. So guys, I already finished with Cauda equina syndrome. If you have any queries, any question, you can ask me. If you're new on my channel, please subscribe it. And if you like this video, put like on it. Thank you. Good day. Goodbye. That's all for today.